everyone. I would like to thank you all for coming out to show your support for this important cause, the lack of family physicians in BC. I would like to thank Camille Curry and Alexis Reid for starting the BC Healthcare Matters movement and allowing a place through their website and email for citizens to tell their stories, and of course today on the story wall. I would also like to thank my fellow volunteers, Pauline Rittenhouse, Anne LaHave, Dr. Bridget Reedy, and Mike Aldridge for their work in passing out flyers and canvassing neighborhoods for the past 3 months. They're in the audience. We had the privilege of speaking with many people who told us of their difficulty in accessing necessary primary care. They told us how their lives had changed for the worse, simply because finding a family doctor in a timely manner is nearly impossible. This situation must change. Here are some examples. My niece, age 62, moved from Alberta 9 years ago. She had a history of cancer. She was unable to find a consistent family physician, and the health information was sent to a local clinic. The referral to an oncologist here for follow-up appeared to get lost, and then COVID happened. My niece has just recently passed away from cancer after weeks of trying to see a doctor, online appointments, extended wait times for blood work and tests. She ended up going to the ER to finally get her diagnosis. I know she would have been diagnosed and started treatment far earlier if she'd been able to find a family physician. It breaks my heart to think how many people are currently in the same position.
Emma.
Shame.
Emma.
I've had a family doctor for a few years, but my adult son doesn't. He has chronic health problems, but I'm a fit and active man in my 50s and rarely need to see my doc. I went to his office and begged them to let my son have my place. They couldn't do it. They were as upset as I was. I'm a young woman in my 20s with type 1 diabetes. My doctor retired a year ago. He told me all the complications I could get with this disease as I age and how careful I must be of my health. I'd like to marry and have kids, but I'm frightened that without continual, uninterrupted, in-person care from a family physician, I won't become a mother, let alone have a long life. My doctor retired several years ago and sent out a letter that he'd found someone to take over his practice. He introduced his replacement in this letter, and I was so relieved because I had high blood pressure and atrial fibrillation. A few months later, I got a letter from him saying it didn't work out and we could have our files printed and sent to us for a charge. 2 years later, I had a heart attack and an emergency angioplasty. That was it, and I still don't have a family doctor. That's me. This is my last story for this segment. My mother-in-law had a history of cancer and was supposed to get regular screenings, but it never happened because there was no GP to arrange it. Recently, she started feeling ill, but walk-in clinics who didn't understand her complex history were unable to diagnose her. Finally, she went to the ER after she started coughing up blood. They diagnosed her with advanced lung cancer, which had already spread to her brain and liver. She died within a month. My wife did her best to coordinate her mom's care during her last days because there was no GP to do it. Our hearts are broken. My wife has lost her mom, and my young children have lost their beloved Nana. A GP would have almost certainly found the cancer sooner and may have saved or at least prolonged her life. They certainly would have made her last days easier and relieved my wife from the stress of trying to play doctor while preparing for the loss of her mom. Politicians, Enough with the Band-Aid solutions. This shortage is killing people. Train more doctors. Pay family doctors a decent wage and create a model of family medicine that is attractive to new doctors. Thank you for listening.